Hi everyone, I'm Fiona Lethbridge, a Senior Press Officer at the Science Media Centre. We are an independent press office working with the UK national media and the scientific community on the big science stories of the day. Here are our thoughts on things to consider when you're reporting on COVID-19. 1. State the source of the story. Is it an interview with a member of the public, official stats on case numbers, or a scientific journal paper? Is it opinion or evidence? Ideally, give enough information for readers to look it up or a web link. 2. Use good scientists. Ask third-party experts for their comments. In the fast-moving COVID-19 story, try and get a sense of what the scientific community thinks about a new specific development or about how promising or otherwise a new study is. Be wary of scientists and press releases over-claiming for studies, and be wary of people who might not be experts making big claims. Scientists are usually experts in quite a narrow field, so check their expertise. 3. Specialist correspondence. If you have one at your outlet, ask your specialist science or health reporter for their thoughts, as they might have covered these sorts of stories before and will have an idea of reputable sources and scientists. 4. The Science Media Centre. Use the Science Media Centre and credible press officers to verify claims if they're not coming from official sources, or to get hold of scientists who can give their opinions. We have a database of experts in various fields who see it as part of their job to help ensure COVID-19 is reported in an accurate, measured and proportionate way. So please call us. 5. Sample size. If you're reporting on a new COVID-19 scientific study, specify its size and nature. Who or what were the subjects? How many were tested? How long did it last? Is it a randomized control trial in COVID-19 patients, or an observational study or an animal study, or a theoretical modelling study? If there's space, mention the major limitations. 6. Stage of science. Give a sense of the stage of any new research you're reporting. Is this a preprint, a very early and preliminary set of data posted for other scientists to see, but that hasn't yet been through the normal checks and balances of peer review? Or is it a full peer-reviewed paper being published in a scientific journal? Science is never final, but some studies are more ready than others. 7. Study type. Distinguish between findings and interpretation or extrapolation. Modelling studies are a key part of epidemic science, but they are often based on assumptions rather than hard data, whereas, for example, genome mapping studies are based on hard data. The type of study is important. All sorts of different studies are needed for scientists to understand this pandemic, but some studies are more definitive and some have more uncertainties than others. So thank you, that's it. All our output on the coronavirus is free to use and can be found at sciencemediacentre.org/tag/COVID-19. Thank you. Cheers.